My name is Monica Gieske. My presentation is on holistic health teaching plan for Ecuador. It's a community health promotion presentation. The problem is an increase in epidemic of HIV/AIDS in Ecuador. Ecuador is one of South America's poorest countries. Its people struggle with serious environmental health issues such as poor sanitation and unavailability of clean water. There's an upward trend of HIV and AIDS epidemic. The Millennium Goals number 6 that it has to deal with is to combat HIV/AIDS. Target 6A is new HIV infections fell 40% between 2000 and 2013. Target 6B, universal access to treatment for HIV patients for all who need it. Learning needs assessment. Primary language spoken is Spanish, so the health promotion plan will be in Spanish. Assess the community's health attitudes and beliefs, and assess physical environment, whether it's urban, rural, suburban. You want to assess the housing, the water supply, climate, population density, their health risks, the health status indicators, nutritional, and immunizations. The health promotion model that I chose is Precede, Proceed, predisposing, reinforcing, and enabling constructs in educational, ecological diagnosis and evaluation will guide development of teaching plan by first planning in 3 phases. The social assessment, learn people's assessment of their own needs, problem-solving capacity, readiness for change, identify major health promotion. We'll get this through state and national surveys, predisposing and enabling factors to initiate and sustain change at the individual level and community level theories to guide interventions. Proceed model, policy, regulatory, and organizational constructs in educational and environmental development, administration and policy assessment policies, and resources identified to facilitate or hinder program implementation. The implementation of planned interventions takes place and impact and evaluations are performed. Health promotion. The goal is that the community realize they have a rise in HIV/AIDS and want to lower their chances of contracting the disease. The health education plan, the behavioral outcomes are to state the ways to contract HIV/AIDS and change their behavior towards decreasing their risk of contracting it, and having access to medical services, prevention, using condoms, diagnosing, and medications for HIV-infected patients. It's another behavioral outcome, and the third behavioral outcome is going to get tested for HIV/AIDS at local clinics or mobile units. Research, 3 evidence-based practice articles. The first one is Ecuador's middle-income country with health issues related to poverty, low education levels, and gender inequality. 99% of HIV/AIDS cases are a result of sexual contact. So assessing the community's beliefs towards religious ideals and sexual activity or promiscuity, and assess educational level and gear teaching to comprehension of material for their educational level. Social workers and psychologists should team up to provide consistent complementary interventions to diagnose and treat people living with HIV/AIDS so that they both reinforce each other and not contradict each other. Data from the Ecuadorian ministry, HIV epidemic is concentrated among the most at-risk populations, including men having sex with men. HIV intervention programs would help decrease HIV infections, and interventions should also help with people living with HIV. And to do this, we could have a popular artist and have a commercial in the media to decrease the stigma associated with people having HIV and then also getting treated for HIV or getting tested to see if they have it. Evaluation. Outcome evaluation measures consequences attributable to health promotion program activities and can show whether you are attaining your program objectives by increase in health knowledge, change in attitude to belief and ability, increase in health behaviors, such as using condoms or abstinence, decrease in risk factors, having unprotected sex, and decrease in morbidity and premature mortality. And we can get that data from the national and state levels. Conclusion, the way forward. Teaching education is going to be important. Prevention by using condoms, health access and checkups, and diagnosing people with HIV, treatment with medications, antiretroviral drugs, target populations such as at-risk youth, and sexual preference, men having sex with men. These are my references.